So it's just, it would just weighs on you, and it's very emotional. It's like, and I remember crying the first time. People want to be heard, they want their story to be heard.
We just need to have a great support system for our women.
This is not their fault. They didn't choose this. This isn't something that they signed up for. This is just something that happened.
Hi, I'm Sabrina, a licensed massage therapist and certified cosmetic surgery specialist. And this is the Roundtable. Just kidding, it's Talk Plastic Surgery. And you already know we talk about the good, the bad, and the ugly. And today, to end season 3, segment 1, not finale, but you already know what I mean. We're doing a roundtable talk all about lipedema. So without further ado, please welcome my guest, the ladies of the Lippy Lymph Ladies. The
Lippy Lymph Ladies.
Absolutely. So, what got you guys into starting your podcast?
I think for me, it's just something that I had thought about over and over and over again. As I'm doing MLD on patients, I would listen to their stories. And I'm like, if I enjoy hearing their stories and I don't have lipedema, I can only imagine how much women with lipedema would like hearing other women talk about their stories. And so that's kind of where the idea came from.
And I love it. And I'm just so glad you guys are putting this amazing information out there. And it's all of your guys' patients, right?
A lot of them are, we want to get on people who aren't our patients too. Like I would love to get lots of non-surgical people on there because more people are dealing with their lipedema in a non-surgical way than those that are opting to have surgery.
Yeah. And they don't even know they have it.
And they don't even And then I think it would be great. We're starting to get more patients that have had surgery with other surgeons than the surgeons we work with. And I think that that's great too, because I think it's good to hear a lot of different perspectives and treatment styles and all the things. We want to represent women as a whole across the U.S., not just where we work.
Yeah, absolutely. And here in beautiful Salt Lake City, right?
Yep.
So then what inspired you to get into lymphatics?
I actually was working in home health, occupational therapy, and there was a large population that had issues with edema and with swelling. And of course, we lumped everyone into the lymphedema category because I didn't know lipedema existed yet. And
that sounds familiar. Yeah. I remember you telling me about that. Yes, yes.
And so when I approached my bosses to say, hey, I'd like to get certified in this, we have a need, we're turning patients away. I just thought that was so sad that we couldn't meet the needs of our patients. And we would have to turn the business away. We had to, anyway. And so at that point, I had reached out to Lisa asking about reputable programs. I didn't follow through with getting certified at the time because my job was willing to help pay, but not right then. And then I think it was probably 6 months later that Lisa reached out asking if I wanted to come in, shadow her. And when I went there, I was like, oh my gosh, this fulfills all my Dr. Pimple Popper fantasies that I didn't know that I had.
But deep down, they were there.
They were there.
Now I feel you. I'm actually the same way. I really am the same way. And when you say you were working in home health, did you guys actually work together?
No.
Because you did that too, right?
For a hot second.
Oh, okay.
Yeah. But that was before.
Got you.
That was before.
Yeah. No, I did hospital-based occupational therapy prior to becoming lymphedema certified.
Yes, and then that's where you discovered the need for it too.
Mm-hmm.
Okay, got you. Wow. So then, how did you get into lymphatics?
So I have lipedema, and so I went through the process of surgery and then MLD'd with Lisa. She was the only one at that time, and so went through that process. And I had just I'm a nurse by trade, but I hadn't worked for a long time because I was taking care of my mother, who had a stroke, and so I was taking care of her, and so then she passed away. So I was like, it's kind of time to do something, to maybe go back to work. But I'm I'm old. And so
You're not that old. My
Your
goodness.
skin looks incredible. Incredible. Yes, yes. Wow.
So I just decided I thought maybe I wanted to be his nurse maybe in the OR. And then I went and did that a day to see what that was like. And I was like, you know what? I just don't want that much stress in my life right now. I'm too old. I don't want that anymore. And so
Yeah.
so then Lisa was like, why don't you come and do MLD with me? Come get certified. And so that's what I did. I went and got certified. And I knew that I knew I wanted to have something to do with the Roxbury because it was so phenomenal. The experience was amazing. All the people were amazing. I was like, I want this. I want to be part of that. And so did it.
Well, which leads me into how did you discover you had lipedema?
You know what? I learned through social media, as most people do.
Oh, wow.
It was Sean, the lipedema mama. He
Oh.
posted a picture of her legs,
Yeah.
and on that she said, "Do you have?" And she listed like 5 to 7 things that do you have this? Do you have this? And I was like, check, check, check. And all of them, and her legs looked basically like my legs. I was like,
Yeah.
and I was sitting on the couch with my husband, and he was on one couch, I was on the other couch, and I said, "This is what I have. This is what I've been looking for my whole life." I knew something was wrong. When I became a nurse, I thought for sure I was gonna figure it out.
Yeah.
Even nurse, no one talked about it during
Right.
school. No one.
Of course not.
I had no idea, and and then the internet came out. I am old. The internet came out. I remember before the internet. I could dial up on my modem.
I'm older than Google, so
So am I. And so I had searched and searched and couldn't find anything back then. That was probably 10 years ago, and I had just given up. And then when I saw it, I was like, really like tears. I was just so validated.
Yeah.
I can't tell you how validating it is for most people. I feel like for most people, we've talked to some patients who have been like, no, I was bad.
wow.
If everyone deals with it really differently. But for
Absolutely.
me, it was pure validation, and I had been searching forever for it. So it was such a good thing for me.
And how soon after discovering that on social media did you discover the Roxbury?
Well, it was pretty quick because then I started searching doctors for it. And then continued to listen to her and Ashley. And I knew, but I was like, Dr. Amron was like from Beverly Hills. And I was like, that's not even going to happen. That'll never happen.
Yeah.
But I finally decided that at least I just want a diagnosis from him because I felt like he was the best of the best. So I wanted a diagnosis. And so I decided to just do that, thinking I'll never have surgery.
Yeah.
But
Yeah.
so I just called and made an appointment, and we did it via Zoom. And he said that they wanted me to have pictures of my body to, that he could look at to do it all. It was like the most horrifying moment
that's what everybody says.
of my life.
It's so
Wow.
traumatic for
I mean,
people.
because you grow up hiding your body. You don't want anyone to see your body,
Yeah, not a shame.
We have to just take pictures, this almost, half naked. And it was super, super hard. And I remember thinking, okay, I have to do it for myself. I have to do this for myself so I can get this diagnosis. And I moped around the whole day. And I was just having my husband. My daughter was a photographer. Her and I had a newborn photography business also. So we had like a big setup downstairs with our cameras and everything. And so
Oh, so you really
I
did.
had my husband just do some pictures for me. But it killed me. It was
Yeah.
the hardest thing to do. And it still is. I mean, even when you decide to then have surgery and you're standing there buck naked, as he draws on your body, you're just mortified. It's mortifying.
Absolutely.
Because of the way that it's just a continual, it's been years and years and years of shame.
Yeah, absolutely. And how long have you, did you end up going through with the surgery?
Yeah, I did. So actually, I found out, and then it was about a year before I really kind of was like, okay, let's get this diagnosed, and decided I wanted to go to Dr. Amron and be diagnosed. And then I was diagnosed in August, and then I had surgery in November.
Oh, wow.
So
Of what year?
of 23.
Oh, so not too far. Like
Yeah,
what?
23.
Like almost 2.5 years ago, 3 years ago?
Yeah. Started with my legs and did that, and then my insurance wouldn't cover my torso or my arms, so I fought with them for a while.
Do they cover the lower body?
They covered his portion, so they don't cover the OR. They don't cover MLD. They don't,
Of course not.
Why would they?
Why would they? What would be recognized?
Yeah, the thing. So, but they covered. It was a good chunk, so it was for his portion. So that was nice. I mean, I'm not.
That's crazy that you even covered it.
Yeah.
Most insurance don't even cover it, right? The lipedema surgery?
Yeah.
Yeah, it's a
a
fight.
Yeah.
It's a fight.
Dang, that's
Mine
crazy.
with Aetna, and that's who he was in network.
Never. Dr. Amron, right?
Dr. Amron.
And he's the one who personally did your surgery. Wow.
And he did it here, so I was.
Oh, in
I
Salt
didn't
Lake
have to
City.
Go to, I was one of the first groups to go through, and I didn't have to. I didn't have to go to Beverly Hills. It was amazing. It was
Because when she called to set it up, they said, "Oh, we have an office
new
in
office.
Salt Lake, right?"
Yeah.
So,
At that appointment, he was like, we're opening one in Murray, and I was like, wait.
Murray, Utah.
What? Beverly Hills, Murray, Utah. So weird. So
Oh, yeah.
it's super great. It's
That's
so-
incredible. And and do you still get MLD done?
Yes. Well, I then later went through to get my arms done and my torso because insurance finally decided they would pay for it. So
Uh-huh. Yes, that's incredible.
that was 2 years later. That was 2 years later. So
Wow.
just did
Oh, like recently?
like in July and
September.
Wow. Well, it's actually fascinating having someone who's had it 3 years ago now. And when I got to meet with Dr. Smart, and he even said that once they do take out the lipids, it is like a patient process. And that as they start shrinking, your lymphatic system starts working better.
Yeah.
So almost 3 years later, how do you feel? How does your body feel?
it's really been for me. It's hard for me to say all the time because I feel it. Not everyone has the same, but for me, it has been life changing. I'm like I feel like I've been given a new lease on life. Like I can sprint. I can go up and down stairs without problems. I have no hip pain anymore. I could go on for days. It's been so good for me.
That's
I
incredible.
really feel like I'm 10 years younger than I was before.
Wow. And then do you guys suggest continuing 3 years later to receive MLD?
I think it really is patient dependent, to be completely honest with you. I would like to see patients be able to get to a place where they can manage it on their own, to be completely honest with you.
Yes.
But there are some patients, like if they're a later stage, they may need it for a while longer, and their needs are going to be different. So
And it depends too on kind of like what your lifestyle's like and how it changes. And I know I would always tell Lisa that I craved MLD. My body craved MLD.
Yeah.
I mean, when I had to wait, longer times to go in, my body would just crave it, and I would feel so good after. So I think it depends. I don't do it on as regular now as I used to, but it does make a big difference. I do it to myself. I do MLD on myself, but it's I think it's totally helpful. Yes.
I also think
people
it
can do it. It's
depends on how active someone is. Like if they're already living an active lifestyle, if they have a pump, if they're going to do the vibration plate, if they're going to do the rebounder, like, are they willing to do self MLD? Just some people are super compliant and like take it to the nth degree and do all the things, wear the compression, and they manage it really well. And then there's others.
Oh, you gotta love those patients, right?
They mean well. And they're trying.
Yeah, exactly. At least to
That's
the
hard.
best of their abilities.
Right.
Because like what else? Like you can bring a horse to water, right? Is that the saying? But at the end of the day, it's their decision whether they choose to take the tools that you ladies give or us that we give and roll with them, or if they're going to just, take it slower.
right.
So what has been your experience with lipedema?
So I didn't know I had lipedema after we were certified, because Jenny and I took our certification through ICLS together. I went to my mother and was like, "Oh my gosh, guess what? I know why you can't wear boots. It's because you have lipedema." And so I was able to very easily see it in my mother, right? But I could not quite see it in myself. I've always had a slender build, but after having children, And now I'm in perimenopause. I mean, I've noticed some changes. I have a lot of pain that no doctors have been able to explain in my thighs. And now I've realized it's kind of starting in my trunk and my abdomen.
Yeah.
Very fibrotic spots. And so it was Lisa who, when I had filmed the video and was like talking, I think because I'm hypermobile, I've got all the things that she was like, hey sister, guess what? You have hypermobility. And I was like, well, I suspected. And then at some point you very gently and nicely was like, and I see your legs.
Well, the first time I saw your legs was when you wore that that tennis skirt to my house to do the podcast.
Oh, okay.
I was like, oh, yeah. Something to you.
It's funny that sometimes you can't see it on yourself, right?
Yeah.
And it's taken me a long time to accept that. I mean, like now I look in the mirror and I'm like, oh, cover those legs.
But I don't.
It has not changed the what I wear, but
Yes.
I have definitely, I see it finally now. And I'm
Yeah.
like, oh, that's funny.
But that's more for you, like even more like putting the pieces together. Other than looking at your legs, it was like you have the migraine,
Yes.
fibromyalgia, you're hypermobile, you have like all the
symptoms.
all the things.
I have all the things that doctors have not been able to put together for me to give me the answer.
Yes.
Yeah.
And so the answer, miraculously, I must be living a good life. Because here it has come.
It's kind of a squirrel.
It just kind of came into your vortex.
It did.
Like
Yes.
subconsciously.
The universe was like, you've had a problem. Here's the
I know. Here's the answer.
Well, and someday there's going to be a time with AI now. Then you can put all these things into,
Oh, I'm sure.
They
Yeah.
go, oh, I'll bet this looks like FT. Yeah. This looks
Right.
like Ehlers-Danlos. They'll see
Right.
it, with all these different symptoms that you had.
That'd be
So
amazing.
it's going to be exciting. I think
That's what someone should do.
Yeah, and actually, and that's the craziest thing. Actually, with AI, there is a whole lot of new people, even just like plastic surgery, like a patient wanting to go in for plastic surgery. I had a surgeon come on the show, and I asked him like, what do you see the future in plastic surgery being? And he was like, having like an AI type photo thing that can show people how they would look when they got whatever procedure they got done. So now, like even on ChatGPT, Gemini, all those AI things, you can actually take a photo of yourself, upload it, and then it kind of like wants to diagnose you if you ask certain questions.
Yeah.
Nice.
Which can be kind of scary, but it's also like, it can be very beneficial, especially kind of seeing what direction medicine mixed with technology
Right.
takes this.
This is a bit of a squirrel moment also, but like I have to admit I'm diabetic.
Yeah.
And I have used AI to help manage my diabetes. Like I have used AI. I put in like the foods that I eat during the day,
Yeah.
and I've had it help me like count carbs, figure out how much insulin to give per carb. Like I've had it help me figure out like, hey, you're probably eating this high sugary meal too late in the day. You should put it earlier in the day. And my insulin has decreased. So people are going to start using AI like crazy.
That's insane.
Oh, yeah.
That it can even help you in that way.
Oh, yeah.
And even like bleeding into lipedema, lymphedema patients with nutrition. Because nutrition's a huge part of this process too, right?
Right.
And what kind of nutritional diet do you guys recommend for patients like this?
Well, it's mostly just the anti-inflammatory, and I think Dr. Amron likes the low gluten, right? Gluten-free. I don't know if you said it. He said, and he had both. Yes, I think he has said that. I'm pretty sure.
Well, there's more coming out about diet. There's a book that Dr. Amato, he is a lipedema researcher and surgeon out of Brazil, I want to say.
Yeah.
And he talks a lot about gluten. So I don't, but when you talk to Bonnie, she's going to have a completely different opinion about gluten. So
Oh, really?
yeah.
I'm excited.
Yeah.
For me, I just think if we focus on anti-inflammatory everything as a lifestyle,
Yeah.
that would be most beneficial for our Lippy ladies. So
Yeah.
Which, ironically enough, the new food pyramid,
Yeah.
the inverted new food pyramid, it's anti-inflammatory if you look at it.
Yep.
Oh, wait, there's a new food pyramid?
Yeah.
What was the old food pyramid?
So the
I'm triangle. Right? Like going to the doctor as a child. Wait a second. Think back
to 5th grade.
I know. Okay, what was the old food
Well,
pyramid?
like they had like fats and stuff down at the bottom and
Yeah.
carbs higher up.
I think I remember seeing bread at the top.
Yeah, and now they have it like flipped. It's inverted now. And they
Yeah.
have fats and proteins at the top, fruits and vegetables under that, and carbs at the very, very bottom, which is like
Oh.
an anti-inflammatory diet.
Yeah. Honestly, I know for myself that I don't have lipedema that I know of. A lymphedema. That, but when I eat bread, I notice I feel puffy, like in general. And when I eat processed food, the next day I feel puffy. Noodles. Oh my God, I feel puffy. So I can only imagine someone who has like these problems. So what is lipedema? And what's the difference between lipedema and lymphedema?
Lisa is the best.
So lipedema, I used to say it's a fat storage disorder. I don't anymore. It's a connective tissue disorder because it affects more than fat. It
Yeah.
affects your veins. It affects your lymphatics. And even the hypermobility of the joints. So it is a connective tissue disorder. Newer research and like kind of a new paradigm coming out is that inflammation is the underlying cause and lipedema is the symptom. So lipedema isn't necessarily the disease process. It's the
Yeah.
symptom of this like inflammatory response that's constantly happening in your body. Now, why? They don't know. They don't know why the inflammatory response is happening. But so that's kind of what lipedema is. It's a connective tissue disorder. It's gonna cause it can cause laxicity in the joints. The fat is kind of connected by fibrosis. And I always tell my
Oh my
patients,
gosh,
if
that's
you
insane.
have like strings and you have fat attached to the ends of each strings, when you have the surgery, the surgeon's going to go in and like cut those strings.
Yeah.
Get rid of the fibrotic tissue, then it's going to release the fat, but still you've got this underlying inflammation. So you've got to figure that out. So it could be diet, it could be stimulating the lymphatic system a little bit more. But yeah, it's the thing about lipedema is as soon as you answer one question, it poses another one. So it's so multi-layered. It, in a nutshell, it's a connective tissue disorder that causes stubborn fat and fibrotic tissue. So the fat is resistant to diet and exercise because it's being held on by these little strings.
Yeah.
Lymphedema is a dysfunction of the lymphatic system. So in lipedema, you might not necessarily have a dysfunction of the lymphatic system. Lymphatics are being impacted, but they're intact. With lymphedema, there's something happening with the lymphatic system that's causing swelling.
Yeah, exactly.
The swelling is different.
Mhm.
In lymphedema, you can get a great deal of reduction with compression and MLD. With lipedema, you're not going to see volume loss. It's just not going to happen because it's not the same kind of swelling.
Yeah, exactly.
So, yeah.
Wow. And talking about the fibrosis that is connecting or attaching to the fat, right? What is fibrosis?
Fibrosis is scar tissue.
Scar tissue. and that's the crazy thing that a lot of people, they're like, what is fibrosis and how does it happen? Because I know with like plastic surgery patients, when I'm dealing with like fibrosis, it is inflammation that it got trapped and it turned hard because it's not being directed properly.
Right.
Yes.
So when we're dealing with lipedema fibrosis, it is because the connective tissue that is attaching to the fat, is it because it's like suffocating, the lymphatic system is being suffocated in a way, right? So then it's not being able to travel to where it needs to get to.
Yeah.
So then it turns hard.
I like to describe, I always talk about grandma's Afghan, you know? Her Afghan on our couch
Grandma's Afghan
is open and there's lots of holes in it, but with the fibrosis, it basically gets all knotted down. There might still be a few holes because that lymphatic fluid might still be getting through, but the surgery can go in and they break that back up again. So that, to me, yes, there's a cosmetic portion of having surgery that they remove some of the fat, and that's great. But to
Yeah.
me, the best part is that it's not tight now. Now it's open and loose.
Yeah.
So your lymphatic system can go in and clean things out and do its job.
Yeah.
Also, that like low lying undercurrent of inflammation, it brings in like it's an inflammatory response. And with that comes in different types of cells that cause fibrotic tissue to form.
Yeah.
We won't get into the chemistry, it's really boring.
But she can say
Later. We will get into the chemistry.
we'll get into chemistry.
So when you guys are when patients come in and see you guys, when do you guys normally see the patient? Do you guys see them preoperatively also?
Sometimes, for example, I got a referral from Dr. Smart. I think I'm seeing her tomorrow, as a matter of fact. He's like, I need her to be decongested. She's not fit for surgery. She's got to get decongested or else I'm not going to perform surgery on her. So it depends on like their level of congestion prior to surgery.
Yeah.
But most of the time we see them the day after surgery. So
Literally day one.
Day one.
Day one. I love
Day 1, day 2,
Yes.
3.
And you know what? I love that we're having this conversation because this is exactly what I'm talking about in general too. Even with like elective plastic surgery. Any
and
kind of
I had a
surgery.
patient today that was post-op day 1, tummy tuck, thigh lift, and breast aug. So, and I feel like, I guess it was yesterday was day 1. Today was day 2. But I'm seeing her for 3 days straight before she travels home. And she needs it. She needs it so much. And she feels so much
Absolutely.
better after MLD. Like when she
Yeah.
walked in, she was miserable. When she walked out, she was smiling and happy, and she felt so much better. So
Yes.
That's
worth
the
it.
best part is that you get that immediate feedback when
Mhm.
you're doing MRI,
Right.
is that they're like, oh, it feels so much better.
Or
They assess it feels so much better.
I can stand it straight
Yes.
or whatever.
Yeah, and you know, and that
Yeah.
but I love that we're having that conversation
Mhm.
because a lot of doctors, they think, oh, wait 1 week.
No,
Oh,
no way.
wait 3 weeks.
No.
And then by that time, they already start building fibrosis. And now we're dealing with scar tissue. And it makes things a lot more harder than if we start day 1. When we start day 1, they're like a clean Play-Doh canvas, right? So then you can literally just move everything, decongest everything, and it makes things a lot easier, and they get into their garments easier, right?
Right.
Yeah.
So what is your guys' favorite garments?
Janine, you wear a lot.
So Dallas is my favorite for the bottom, for the pantyhose. And I really have not found, I have it, as you can see, I'm still wearing my post-op, the top,
Marina.
Marina. So I do like it. I know it's not, probably should be doing a little bit more compression probably, but
It's a little loose.
Right.
It's a little loose.
It's not too loose actually. It feels pretty good. It's
My Alice has a tie.
arms are a little loose.
They do. A lot of people like
I
it.
tried it on and I have not liked it.
Oh.
Tell them what you're most.
Nutty all shade.
Most favorite is the nighttime one.
Yes,
Which is
you have a
I
problem.
know they need to put me in a commercial.
They do.
They should.
The comfy wave
That should
should
be
be
the
they said that
Comfy
type
Wave.
one, and it is.
Oh, is that the name of the brand? The Comfy Wave? Oh, I thought it was like a nighttime lymphedema Baja brand or something.
It's to wear at night. It's a nighttime one. It's 50.
Oh,
I think.
Yeah, and truthfully, it's really for lymphedema. But she
Oh,
has
got
some
you.
really stubborn ankle swelling.
And it has helped me so much. And they're so comfy. They really are. Like, I can't wait to put them on at night.
Oh, that's awesome.
Comes I'm like, take off. This is Alice. Put off.
She's so excited. Look at her face. Oh my
It's
gosh.
a brand out of the UK, and they are gaining like momentum amongst lymphedema therapists across the US.
Yeah.
Big time. I mean, they have, I just barely ordered one for a breast cancer patient. So like
Oh.
raw for breast cancer, but they have one that goes around the hips. They have full thighs. Like they've got everything that you can think of.
But they're
comfy.
they're easy to get on, and it's like in your butt. It's like a hug.
Sorry,
It's like a hug. It's
There's,
They are
you know what?
expensive.
I feel like most compression garments are pretty pricey. You just gotta be well, and you know what? That's actually a great question. As you start to shrink, like, how many compression garments do you feel like you need? Do you notice yourself even shrinking from like 3 years ago, like for your bottoms?
Still shrinking from 3 years ago.
No, but okay, do you remember this? At the end of your 6 weeks after your first surgery, I said, "Ma'am, what did I do you remember what I told you?" I said, "That compression is hanging on your ankle and it's on the ankle." Yeah. Bang.
Yes, exactly.
But I did
Exactly.
I mean, I think because I'm a little older, I think I feel the need to wear them more often, and so I didn't do as well on my first surgery, and then when the second time around, I did it better, and I've healed better. I feel like it's just good for me. So I do. You need like a pair a day.
Yeah.
I want to just wash them at night and hang them up, and that it's just a pain. So
100%.
and then they get big, and then they wear out, and then you have to get more. I mean, it's an expensive disease process.
What do you like? What do you like?
I would like to know which fajas you like specific for
Plastic surgery?
Yeah.
So, this is the devil. I'm actually going to meet with my friend tomorrow. She's in New Jersey. We're going to do a video call because she has her own compression garments that she has found in Colombia. And she sizes people. Like she chats with them, gets them sized, and then she sends them the size that they can shrink into. So it's smaller. But then she did what is it called? Juzo.
Juzo.
She did a Juzo certification for specifically all about compression. So she discovered this foam too, that it's a poly something foam.
Complex too, probably.
Yeah.
Yes,
probably.
and that she puts it in a specific lymphatic mapping in her compression garments that she likes. And so that's why I want to talk to her, because I've seen all of the Amazon ones. I've seen Snatched Body. There's places in Las Vegas that I've sent people to, and they either work or they don't work, and they're very expensive. I have one patient who just found one for $40 on Amazon, and I actually like it, and it works for her. And I actually love taping. So I'm trained in the Brazilian way of lymphatic taping. So then they cut the strands in a specific way, and then we apply it in the direction of lymphatic mapping. So after I decongest the body, then I clean off the whatever I use, and then I put the tape in the direction of the flow. And sometimes with patients that have really bad fibrosis, I tell them, you know what, let's just do a full tape faja, as we like to say it. And then that's all they wear. And then they come back in, I remove the tape, and then they get back into whatever compression garment works for them. Because they have to love it. You know what I mean? You're going to be in it. When you have plastic surgery, you're in it for about 12 weeks to 6 months to a year. It's up to them. But 12 weeks, I say, because that is when they're going to be the most swollen. But I have seen where people come to me with horrible fibrosis. I put the tape on them. I said, don't wear the faja because it's actually messing you up more than helping you. And then they come back, I remove the tape, and the fibrosis is almost gone, like magic. And so I have seen good compression garments like on Amazon, Snatched Body, to answer your question stuff.
Yeah, okay.
But I feel like once I meet with my friend tomorrow, and I want to see her foam, because foam has helped people a lot with getting their inflammation down too. And on that note, what are your guys' thoughts on using foam?
There's a place for it. Yeah, and we use it. Our surgeon likes it post-operatively, and so we use it to help decongest the area. Foam, basically, if you're using like the channeling foam, or they call it there's like a generic way of calling it negative space foam, I think is what they call it. Foam with negative space is basically channeling foam.
And it's green.
There's some that's green, and then there's Comprex 2, which is white.
Okay, got you.
When we went through our lymphatic course, we were taught that was used pretty specifically for patients with lymphedema, who have really fibrotic skin. And I'm talking about like the elephant skin. I'm talking about
Yeah.
so hard you can't even move it
Yeah.
type of skin.
No, I know exactly what you're talking about.
To help break up that fibrotic tissue, right?
Yes.
And our doctor uses it. So our protocol is MLD post-op day 1, and we begin bandaging at that time with the negative space foam. So,
Yeah. Oh, and then so you do the wrapping?
yeah, we do short stretch bandages.
Wow. And do you do that in the beginning and then you put them into like a full garment?
The garment goes on top of all the wraps. Our patients love it.
I know. That's why I'm like, you got to fall in love with the compression garment.
You got to think long game here.
Exactly. Because you're gonna be in it for a while, and
I think if patients really understood why, they might embrace it a little bit more. So
absolutely.
if they understand like, hey, not only is this reducing swelling, it's helping shape the body and skin tightening. Most of the time they're like, oh, yeah, because I just spent a crap ton of money on this procedure and I want my skin to.
Right.
And everyone hates being wrapped, but when you know it's for the
It's for the best.
it's worth it. You know, it's worth it. And you
Yeah.
have surgery and you're smaller, but you're walking out there like an elephant. You know, you got these big, huge legs.
And imagine if they didn't have compression garments. If they didn't have any compression garments,
bad.
then it would be horrible.
Yeah.
And that's why some doctors, like there's a doctor in Vegas who doesn't like compression garments at all.
Whoa. Really?
And yeah, he's like, they're a waste of time. It's just a myth from Colombia. That's it.
Can you imagine? I'd love to be in a room with him. We could have fights here. Lisa's like, I'm ready to go.
No, that's actually exactly my thing. And the thing is, and it's funny because with a lot of his patients, he tells them if no faja, but you have to get massages every day. And I'm like, okay, well, this is going to be very expensive for you.
Yeah.
I'm like, you could get in the garment. The garment's going to help you save money, but I'm like,
So is that where you do the Brazilian taping then to help them with
that's what I like to do.
instead?
Yes.
So that
Yeah,
so they're trying to follow the doctor, but also get best results.
Exactly.
That puts you in a tough spot.
Oh, girl, I have gone and it's hard because I had one patient that was friends with this doctor.
Oh man.
And then I'm trying, and he likes to work on more of ladies of the evening, if you know what I mean. And this is a mom, like she's more of a mom build, you know, they're friends, and she wants that physique. Well, I'm like, look, it's going to be really hard to attain that, especially if I'm not massaging you every day and you're not in a garment. And then I tried to put her in one. She started to get better. And then he saw a line, because, you know, they're like Play-Doh. And he's like, get out of that. I told you not to be in the garment. And so that's it can be a challenge, but that's kind of where you as the practitioner, because I see like people from all different doctors, I have to think about myself and be like, look, you're not taking my advice, and this is going to reflect badly on me at the end, and we're not a good fit.
Well, it's interesting. I have like 2 points to that. Is first of all, MLD is a short-lived response,
Yeah.
right? So I always tell my patients, I'm like, I'm going to get your lymphatic motor running,
Yeah,
and this compression is going to do the heavy lifting after that.
exactly.
Because it's going to keep you decongested.
Right.
That's what compression is.
Yeah.
So a lot of people think, oh, you can put me in compression and I'm going to get smaller. No, compression is meant to contain. It's not meant to reduce. So
Yes, that's actually what my friend said.
Yes.
That's exactly what my friend said too.
So compression is going to do the heavy lifting. It's going to keep you contained. And number 2, I'm so grateful for the doctors that we work with
Absolutely.
because they really defer to us on all of that. They're like, hey, that's your guys' jam. Like, of course, we run everything past them. We want their medical advice on things, but they're like, yeah, you guys know your stuff.
They trust you.
Trust you.
Yeah.
And we trust that you're going to take good care of our patients. And if you really had a good understanding of the lymphatic system, you would know how important compression really is. But we know doctors don't get a lot of lymphatic education in medical school, so that doesn't shock me. Right?
That's true. That's true.
I know. I've heard. When I spoke with one doctor, I think he even told me that they only have like one day where they go over the lymphatic system, just like one day.
Yep.
Even like in nursing school, how did you guys go over the lymphatic system?
Very. I mean, not enough to know that there was that the lipedema wasn't mentioned for sure.
Yeah, or even like the direction of the lymphatic
Yeah, like
system and the
mapping and all
opening.
that is not.
Yeah.
No.
We actually just had
Yeah.
someone on our podcast who her brother is in medical school. And so he's been enjoying her journey. She's been helping him, learn as she's learned about her lipedema. And I think that she said that he only had one day as well. And that's
Yes,
2025, 2026.
but he also said that lipedema was actually mentioned in class.
Yes, he did.
Oh,
So that is a huge improvement.
That is like
that is a huge improvement.
big victory. In
That
the
lets you know how much is getting out there.
Right.
I mean, they can't like ignore it for too long, you know.
I know. Yeah, 100%.
I know you'll agree with me. I know all of you will agree with me. And I know I'm biased, but I think the lymphatic system is the unsung hero. It does way more than it's given credit for.
Yep.
Yeah, absolutely.
Way more than it's given credit for.
And it blows my mind that it's barely being brought to light in the States. I know more in like Europe.
Yeah.
They've studied it a lot in
Yeah.
Greece. They're huge on lipedema. I've actually had a patient who went to Sweden, Sweden, to have her lipedema surgery done. And her doctor over there, like she had to wait a year and a half.
Wow.
Yeah.
And
To him.
to get into her. Yeah. And then
It's a she over there.
yeah,
That's
and then
cool.
and when she came back and it was so crazy because last time we spoke, I think I brought this up to you. She had it removed everywhere. Her calves, her thighs, her hips, pelvis, like 360 pelvis, arms and forearms. But she didn't do her butt, and she was so concerned. She was like, "What if it comes back there?" And I have had another patient that she had it removed in her calves. And she's like super grade 1. You look at her, you would never even think she had lipedema. And until she told me, and I was massaging her legs, and you can feel the nodules. And I'm like, but she's super healthy. She's super health conscious. She's super about her nutrition, exercise, compression, everything, all that. So she's managing it really well. But if they get rid of it in one area, is it possible for it to grow back in another area? Can it come back?
Who wants to take that one? Well, I don't know that it comes back.
Yeah.
I think it just becomes more prolific in that area.
I think it never left.
Oh.
So, for example,
Oh, because they didn't take it out.
You can't get it all.
Yeah,
That's
yeah.
my Janaeism. You can't get it all.
Yeah.
you can't.
You can't get it.
You can't.
For example, I've had so many patients come back and say, "You even."
Mm-hmm.
And the girls?
Well, yeah. So you can get lipedema there, but like
You can?
oh yeah, yeah.
I didn't know that.
It's the world according to me.
Okay, so this might just be an aha moment for me. Is that why my breasts are so fibrous and dense? And every time I have a
There's a connection there.
no, seriously, like I've never made this connection.
I have. Not on your side.
Well, that's what
Well, I don't remember it.
That goes back to the you saying, "Oh, I have lipedema." She's like, "Oh, I know."
I thought when I was doing your breast exam that one. I don't do
never
breast
done
exam. No. I only say that because I have fibrotic. Like every single time I have a mammogram, they're like, "You have fibrotic breast
Yes,
tissue."
it's so dense they can't see anything,
so
and they hurt. They
Wow.
hurt so bad.
there's not a research. There's been no
Of
research
course not.
about it.
Who's gonna research that? Not a man, and we're in a man's world. I'm gonna go off about that.
All right.
You know what? So I can't wait for that to start because I am actually a certified breast massage therapist. My breast massage teacher, she had 15 reconstructive breast surgeries because of breast cancer.
Yeah.
And in that, she and another one of my friends, they created this breast massage to help women through that. So, and it's just so crazy how little our breasts are even studied,
Right.
right?
Yep.
Or worked on.
Mhm.
And a lot of doctors that when women decide to get implants and whatnot, and I'm sure you guys see it with a lot of the loose skin being cut off, now they're getting their breasts lifted and whatnot, that they're like, do not touch the breast, do not massage the breast, don't work that area. And then they look hard
Yes.
and fibrotic.
Yes.
And then I'm like, I'm gonna touch your boobs whether you like it or not.
Right.
Of course I get consent, but I'm like, but then the next day they're like, I can't believe my doctor told me not to work my breast. And I'm like, even if you haven't had plastic surgery, as women, we should be massaging our breasts regularly. We need to know how they feel
Yeah.
Right.
and if there's anything going on in there.
Well, here's something like since we're going there, like a
Yeah.
lot of times when women have their pelvic girdles done, they get swelling into the mons,
Mhm.
and we treat
100%.
that all the time.
Absolutely, and even more with because lipedema, how it's so what is the word? Prolific in the thighs.
Yeah.
That area in the pubic area, can you get lipedema there?
Yes.
Mhm.
Our surgeons will treat that area.
Wow, that's insane. And so then, yeah, even in the breasts. And so then, if they remove it everywhere, but they didn't remove it in the butt, can it expand?
I would say yes. Just
Wow.
again, there's not been research done, but anecdotally, I had patients come back and
I was gonna say
say,
it's one that patients say a lot.
and then is mostly torso. I hear abdomen,
Yeah,
Abdomen's the biggest one, yeah.
Yeah. Well, not to
So, but if
mention-
you've had it everywhere else and not your butt, that's probably where they would say it. You know, I feel like it's mine. I think is
Is the
grown. So,
And I will say also, like, you couple that with, so I just read a recent research study that talks about menopause and lipedema growth in the abdomen.
Yeah.
And it's based off of you having more estrogen beta B or something like that over estrogen beta A, or I don't remember they have like estrogen A and estrogen B. And it's because your estrogen levels get out of balance. And so
Yeah.
you get higher levels of this other type of estrogen, and it causes, which a lot of women with menopause get, that's when they start to get the abdominal fat. But if you have lipedema there already, it's just going to be
Worse.
exacerbated.
No.
Wow. That was beautiful. That was crazy. But you know, circling back to actually what we're talking about with like how your doctors trust you. When I met Dr. Smart, one, he is an incredible man.
He's the nicest.
He is the nicest guy. Seeing him with Nikki, who I'm going to put the link in the bio to their podcast with all of their podcast episodes. Nikki, if you've seen this segment, she was in our show too. Also their patient.
Our patient.
Our patient. That being said, seeing him with her, oh my God.
I know.
Top tier.
what you
Top
see-
tier
what
service.
you see is what you get.
He was not putting on airs.
He
That
wasn't.
is him.
He is that.
Oh,
way.
I could feel it.
Sorry, buddy.
He's that way.
Everything.
Single patient.
He cares.
Take care.
Yes.
He cares.
Very much.
Absolutely. And just seeing, even like when I was just in the room, him even telling me, like, and I was telling him, like, because, you know, she came to Vegas and I'm the one who sees her off now. And I'm like telling him, like, oh, this is what I feel. And I'm noticing a difference here. And he's like, oh, yeah, I feel that. And he's touching her and just giving her advice and then taking what I say. And I can see how he trusts you guys. And you don't get that a lot with surgeons. That's the craziest thing, because we are the ones that spend the most time with the patient afterwards. We see them more regularly. So having that trust, and that's why Roxbury is like the GOAT in lipedema. They really are. Like, they really are. And I love how they're expanding.
Yes, and I do have to say that it's a very collaborative process, because there are times where I'll get phone calls from Dr. Aaron or Dr. Smart, and they're like, hey, this patient's really struggling. Like, what do you think? What can we do? Like,
Yeah.
how often have you had, I mean, you worked with doctors a lot. How often did that happen for you? So the fact that they respect us enough to ask our opinions, like,
Speaks volumes. Smart will come into the room while you're doing MLD the day after, or 2 days after, whatever, and he'll say, "What do you think?"
Yeah.
To me, what do you think?
Or you just, I mean, Dr. Smart and Dr. Amron will just poke their head in if they're there for surgeries just to check on the patient from the day before, which is awesome. So
Yeah.
Just great.
And the other thing about our doctors is, and I can't speak highly enough about them, is because, and again, I know I'm biased, but we've talked about this on one of our podcasts, is they're willing to change protocols as they see, as things progress, or they're like, hey, there's this problem that we're seeing over here in this area. Like their egos aren't so large.
Yeah.
They don't see problems that need fixing and then fix them. Like I've been with Roxbury 2.5 years and I've seen protocols change multiple times for the better, you know?
No, I love that.
I do too.
I love a doctor who could take accountability.
Yeah.
And even see that if there's something that needs to be changed, because if it's not working, but then this is working, then they're like, okay, we're gonna go in this direction, but then this is working, so then now we're gonna do all of this. Like that's beautiful.
Education.
That's awesome.
Yeah, they are great.
Oh my gosh, this has been so incredible. And you know what, ladies? On that note, let's start some rapid fire questions. So, you know, for question number 1, where do you guys see the future of lipedema being? And we'll go one by one. So
you're looking at me. Cool.
I think I kind of already said mine, but
The future of lipedema. I mean, I just see us doing more research. I mean, all the things that we mentioned that we don't know, there's so much we don't know. I think we're just going to grow. I think we're just going to keep improving our processes and learning more. I think we're at the beginning, or we're pretty, I mean, we have so, right. We've got so far to go.
so far to go.
yeah. I think like what I said, I think it just medically, everything is going so fast now. You know, I think with AI and all that coming in, I think it's just going to get better and better. Even the processes, even the, you know, all of the things. I think it's going to be, it's so exciting. I wish I was 30 years younger.
Even better. You're the age that you are now.
It's good.
I love it.
I think for me, in a perfect world, it's going to be lipedema removal surgery is going to be more accessible to more women.
Insurance. Absolutely.
And I think that we're going to eventually get to the root cause. It's going to take time, but I think they're going to figure it out. Yeah.
I love
Working
that.
hard. They're working hard. Yeah.
Yes, I love all the answers. So beautiful. And for question number 2, what is your guys' favorite at-home activity for patients to do to facilitate them in their healing?
To facilitate them in their healing. I guess after.
Like homework.
I would say probably, I don't know if you want immediate homework or later on homework. Immediate homework immediate homework is drinking water with electrolytes. Hydration, like stay on top of that. Long term, I think a vibration plate.
Oh, I love that.
Yeah. Get yourself a vibration plate. They're cheap.
Yeah, exactly. And then use it all the time.
For me, it would be nutrition, and then I love my vibration plate and my pump. I do that every single night. It's my, except maybe not. By the time I get home. But I love it. That's my routine every night is vibration plate and then the pump. And it's just my time. And I love it. It helps me. I just feel so much better doing that.
And just a helpful hint on that note, do the vibration plate first and then the pump next.
Okay. Yep.
For me, it's compliance with compression. Like,
Yes, exactly.
have to be compliant with
the compression.
And then number 2 is, and I've started doing this, and I haven't even told you guys.
Oh, nice.
Coming to you live for the first time on Talk Fasting Surgery. We're all my
Hit the rest of you.
So I've started having my patients go to the countertop and going up on their tippy toes to do calf strengthening and then mini squats, because the calf is considered the second heart of the body.
Absolutely. I've actually heard that before. Yes.
So
And circulation is a huge part of the lymphatic system.
exactly.
I've just told them ankle pumps, but you're right. That's taking it to the next level.
100%. I never even thought about that. That's incredible.
Thank you.
Yeah. Now I'm going to use that.
Please do. I mean, the more people that can get help with it, the better. But like the lymphatic system doesn't have valves, and well, it does have valves. I guess you shouldn't say that, but like like with the cardiovascular system.
It's pumped by the heart.
It's pumped by the heart. The lymphatic system doesn't have that.
Nope.
So it has deep breathing and it has muscle movement.
Absolutely. That's really what pumps the lymphatic system.
Exactly. So
Wow.
I tell them to go do mini squats, as long as they're not feeling lightheaded or dizzy,
Right.
to do mini squats and calf raises.
And I feel like the one I should have said really was making sure all of our patients do activate the big six, like activate your lymph nodes. I mean, it's not hard. Do deep breathing.
You know what? And that's exactly why I have like a mini video on my Instagram that I send to people. I'm like, here,
You need to
do what I do to you in the beginning of each session.
Right, right.
You can do, and it's super easy. Just,
Yeah.
you
all the
know,
things.
and, but yeah, no, that's actually great advice.
I tell my patients every time you take your garment down to use the restroom, stimulate your inguinals every time. Especially if you have legs down, do it every time.
Every time. It does not hurt.
Nope.
And for question number 3, how do you guys see lipedema and emotion coming? Like, how, you know what? Let me actually rephrase that. How? What is the right behind you? What is the big emotional part of lipedema?
Well,
Do you want to go first?
it's hard. It's because it starts so young for a lot of people.
Yeah.
For me, I mean, really like 10 probably when
Oh,
I started noticing
wow.
that my legs didn't look like my friends, and so it was emotionally. I don't know if you ever really get adjusted again. Like, I'm starting to feel good about myself now, but it's a little bit.
Yeah.
I mean, it's hard. It's as you've grown up your whole life just, trying to hide your legs, trying to hide your weight and your. So it's just it would just weighs on you, and it's very emotional. It's kind of feel like I've got gypped a lot of my teenage life and young life, because I dwelt. So, I mean, now I would tell myself, give it up. It doesn't matter, of course, but that's not how it is when you're going through it and you're young and you're, it's just super hard. And even now as a 59-year-old, I'm like, it's hard. It doesn't get easier. The older you get, I still struggle with that.
Like
Not
you're still a
really.
teenage girl.
Yeah.
Mm-hmm.
Yeah. Feeling like, oh, I don't look good in this, or I don't, whatever. It's silly, but it sounds so sometimes, but it was very emotional. I mean, it's very much part of your life, and it's hard to reroute your brain, because that's just all you've known.
And it's okay, everything that you are feeling.
Yeah.
I think that's the biggest thing when dealing with the emotional aspect of this, is that knowing everything that you're feeling is validated. You have the right to feel the way that you feel. And at the end of the day, this doesn't catch up faster than this.
Yeah, it doesn't.
And that's why photos are so good.
That's what I tell my patients. It's the most important thing, because your brain is tricky.
So tricky.
Your brain plays tricks on you. And I mean, I can't tell you how many times I'd go into Lisa for MLT and be like, I don't see it. It's coming back. It's all these things. And it's not. But but I take pictures very often so that I know where I'm at, so I can check myself and be like,
You get that visual feedback.
yeah, I get it. I'm like, okay, I look good. It's fine. So, but it's hard. It's constant. It's all the time. It's all consuming sometimes.
Absolutely. And how do you guys deal with it with your patients?
I fall back on my occupational therapy background, where I make sure that people know about the podcast that we have, or direct them to social media, or if they need someone to connect with, because we just need to have a great support system for our women. So I think that's why our podcast, why I feel like it's so important, and what you're doing, and why this is so important, because women need to know they're not alone, and they need to know that we are there for each
I
other.
also think one of the great things about MLD, like right after surgeries and stuff, is that like Lisa listened to me and listened to me cry about just listen to my story. How I found out what my life was like, and I remember crying the first time. people want to be heard. You know, they want their story to be heard. That's why I love our podcast, because I love people's story. But I think it's so awesome that we listen to their stories because they want to be heard and they want us to tell it. So I love that about the MLD. It gives us a space to talk and to understand.
Really get to know each other and
Yeah.
appreciate each other, and just kind of give that love to our patients when they are in such a vulnerable place.
Absolutely. And community.
Definitely. Yeah, for me, I always reiterate the point that this is not their fault. They didn't choose this. This isn't something that they signed up for. This is just something that happened. And
It's really good at that. I think you're really good at that.
thank you. I let them know that, it's not for a lack of them not trying, or it's just the way that their genetics showed up. And unfortunately, it didn't show up the way that they wanted it to, but there's a lot that can be done conservatively and surgically. And I just let them cry.
Absolutely.
I just let them cry.
And you know what? We hold emotional trauma in our body.
1,000%.
And that's where the fascial system and the lymphatic system really connect. And when we are releasing these restrictions, fibrosis, that can come up and surface. And it's not good to hold it in. You got to let it out. Because now you're safe. Now you can. And it's okay.
Someone understands.
Just like what Lisa said, you didn't choose this. It's not like you wanted to go have lipo all over your whole body. Like this is medically necessary plastic surgery.
Correct.
And this is why insurance should cover it.
Yes.
Period.
Amen.
Period. Like, not even a question.
Correct.
Insurance should cover this. This is not something that is a choice, just like us choosing to have babies. Like, we didn't want to be split open for 9 months.
Yeah.
Like, why can't insurance cover my abdominal muscles to be sewn
Right.
back?
Yeah.
The thing is that no matter what, like, this is a very emotional journey.
Definitely.
And understanding it and just having a podcast, having a community to come to be able to talk to people, and eventually to be able to communicate with other people who've had this and know that they're not alone.
Right.
Yeah. Thank you guys so much for coming on my show.
Thanks for having
And my last question that I ask everybody who comes on the show, if you have any advice to give to somebody who's thinking about having lipedema plastic surgery, what advice would you give to them?
Do it.
Yes, I love that.
But I know
Yes.
it's a financial burden. Like,
Yes.
that's the saddest thing. If it were all insurance, paid for and everything, I would say do it.
Yeah.
I mean, not everybody can. I feel so blessed that I've been able to do that. And once again, I'm older, so I have been able to do it because we've come a long ways in our life, where I couldn't have done it when I was 20.
Yeah.
I could have done preventative things though. I could have done the nutrition thing better. I could have done the
you
plate,
didn't
the
know.
pump, but I didn't know.
Yeah.
But so for people who, are looking at lipos, I mean, it's a game changer. To me, it sounds cliche, but it's a game changer. Changes your life for real. And
you only
so
get
many
one.
ways. You only get one.
You only get one,
Yeah.
I think my advice would be do all the conservative stuff first. Like, start with the conservative stuff so that you are in a good, routine. You're wearing the compression, you're doing the pump, you're doing the vibration plate. Did I say nutrition already? No. Anyway,
but that's
do
part of
nutrition.
it.
Do all the things. Probably get on a low dose of a GLP-1 for inflammation purposes. Talk to your doctor, but have all of that set up and then come in. And I mean,
For sure.
if I could do it tomorrow, I would do it tomorrow.
Right. Yeah. Exactly.
Incredible.
I think for me, the advice I would give somebody is to make sure that you go with a surgeon that you feel comfortable with, somebody who's experienced in lipedema removal surgery.
Yeah.
Not just any plastic surgeon. I think somebody who knows about lipedema, somebody who knows about the lymphatics, and somebody that you feel comfortable and safe with. That's what I would say.
Oh my God. the response, the answers across the board, 10 out of 10. Oh my gosh. The Lippy Lymph Ladies, guys. Oh my God, I love it. This has been absolutely incredible. Once again, thank you guys so much for coming on my show, being my first time interviewing 3 people all at once.
Such a
with 3 cameras.
You're natural.
And you know what? Like this was incredible. This was beautiful. This is gonna help so many people. And of course, I'm gonna put all the links in the bio to their podcast. Go watch it, especially if you enjoyed this segment all about lipedema. Go listen to their podcast because you're gonna hear amazing stories all about patients that have lipedema. And then you're gonna understand a different sense of community, and you're gonna see in a whole big, different, broader spectrum of lipedema and spreading the awareness, because that's what we got. Right?
Absolutely.
So thank you guys again so much for coming on the show. I appreciate it. And as always, like, share, subscribe, hit the push notifications for all things Talk Plastic Surgery. Bye.